Hi guys, and welcome to episode 10 of Crazy by Austin Munara, a limited edition series. Uh, so episode 10 is going to be about DID, which is code for dissociative identity disorder. So this disorder comes about when a person, usually at a young age, experiences a traumatic disorder, which in terms results to an identity, a split personality deficiency, right? So you'd say they just split in half. Like sometimes you're about this stuff and other times you're about this stuff. uh, like for myself, don't know if I suffer from it, but I'd say sometimes I'm a rapper, sometimes I'm normal, right? Because I make music. So because of traumatic experiences, someone tends to behave in a similar manner. So DID could definitely be considered a split personality disorder, which is why we are including it in our mental illness issue cover. In Crazy, we say the idea is split personality, which the patient usually, because of traumatic disorder, tends to behave behaviorally in certain times during the day. So they say the day happens to a lot of people. Well, not that many, around 2 to 4%, 2.8 to 4%. Uh, they say DID is treatable. There is medicine for DID, yet it's not widely uncommon. It's not wide and common. It usually doesn't happen to most of us, but we have seen in Crazy that personality disorders happen way too often, and as a result, there is a lot of medical practitioners working day and night to try and get a hold of the situation, and that's why you don't see a lot of patients out there anymore. So, yeah, this disorder is not that bad because in time people usually get a hang of themselves, but as a split personality, uh, you either this way today, this way tomorrow, this way in this mood, and this way in another mood. Certain events can cause this DID. As you can see, clearly I must be patient zero of this thing. Clearly, DID for sure. But as you can see, it's not that bad. It's definitely a mental disorder, especially if you're like me and you're not that official, you're just making music on the underground. Uh, but what I would say is that some antipsychotics, a trip to the psychiatrist, some therapy will get you right back on your feet and where you need to be. I don't think the idea has been associated with violent behavior. People don't usually go crazy and bonkers and mad. Yet it doesn't occur that often, but such cases should be monitored because this type of behavior are on the table. Such things like violent behavior are definitely on the table for such people, because 1 minute you're okay, then you snap and your spouse is dead, badly hurt in the hospital. So yeah, mental illness is something you need to be aware of. uh, it's something you need to good care of take good care of your mental health. Watch what you eat, as I said in the previous episode. I don't know if a lot of you are watching this show right now, but we've covered a lot of split personality cases, and I would say that you need to be better about what you consume. I don't know how you're going to operate this, because diagnoses are really dangerous, but you need to take a medical care, take several visits to the hospital to check on your health, on your blood pressure, yeah, such things. So we won't say too much about the that's about it, and that was episode 10.